Thank you for joining us for this webinar, and obviously there's a lot going on. So I want to start by thanking Dr. Torian Easterling. I'm sure you've seen him on your TV screen, heard him on your radio station, because I surely do every morning, preaching the importance of getting vaccinated and of course staying tested, and also social distancing and wearing our mask and trying to be safe. Where we're currently at in Queens, 1.8 million residents are vaccinated, and proud to say that Queens continues to lead the city in vaccination. But even with that lead, there are still a lot of folks who are unvaccinated, who are not vaccinated, and we're working to close that gap. So if you are on this line tonight and have questions about the vaccine, Dr. Easterling is here to reassure you that you're going to be okay. The other thing I want to add is, the vaccine is being offered now to those between the ages of 5 and 11. I'm a dad. My son got his first shot last week, 2 weeks ago, now scheduled for the second shot. So we want to make sure that we're doing everything to keep our children safe, especially as they are in a school setting as well. So very important that we do that moving forward. Some quick updates. I know there's been a lot of questions around testing sites and access, and we're working very closely with both the Department of Health, both on the city level and state level. If you're finding or having difficulty getting tested, Borough Hall is open. So if you are able to get to Borough Hall, we urge you to come and get tested there. We're open every day there. And then we also, starting on tomorrow, are going to be offering vaccinations on December 21st, 23rd, 28th, 30th, January 4th, January 6th from 8 a.m. to 6 p.m. And we'll be making that announcement in the morning. So until then, we are putting out, and if you don't have information on where you can be tested, you can go to our Twitter page, or you can reach out to our office, and we can make sure that you get that information, and perhaps somebody will put the Department of Health's updated sheet in the inbox this evening for you to know where you can go to get tested specifically. But I just want to end before we turn it over to the Department of Health and really stressing the need for us to get vaccinated. And yes, there are breakthrough cases, but the point is that we don't want you to get severe illness. That's the point. And the folks I think that we are seeing really struggling at this moment in our hospital systems are largely unvaccinated individuals. And I know Dr. Easterling will touch on that as we move forward. So mission doesn't change. We don't want to have to shut down the city. We don't want to have to shut things down. We're moving into the holiday season. We really need folks to get tested and vaccinated before they enjoy a hearty meal, perhaps for Christmas, Kwanzaa, and in the new year, because we know we're all going to be congregating together with our family members. And it's really about keeping our families safe, ensuring that we keep our community safe, and personal responsibility is key. And in terms of doing all of the things that I just spoke about. So mask wearing, getting vaccinated, and of course, like I said, we are fighting to expand testing sites across the borough. The mayor did talk about that today, and we've been in touch with his office. So we do anticipate some more sites opening up in Queens, and we anticipate the governor also announcing some more sites as well, and asking for federal intervention as we move forward as well for more testing kits to be taken home as well for you to order those. So with that being said, I want to thank Dr. Easterling, who's really been a steadfast partner with our office. I am proud of all the progress we have made in Queens, but we're not out of the woods. And we can't go back to, as I say, partying like it's 1999 if we are not taking responsibility and getting vaccinated and imploring our friends and family members to do the same. So with that being said, thank you for joining us, Dr. Easterling. I also want to thank my Deputy Chief of Staff, Brent Weisbarg, who's been great on this issue consistently and working with us. And I want to thank the Department of Health staff as well, who've really been firm partners as well. So now it gives me great honor to turn it over for the person you came to hear from, and that is Dr. Easterling. Thank you for joining us.
Thank you so much, Borough President Richards. And certainly thank you for your partnership and to your office I certainly have done town halls and events during every peak, every valley that we've gone through during this pandemic. And, the collective resiliency of this city has certainly have guided us in making sure that we're out getting the message out to our communities, engaging residents, and just making sure that we are supporting everyone through this ordeal. And again, just want to thank you for the work that you've done in your office to get the word out. I think the first thing that I want to say is that the landscape is changing. It's different than a week ago, than 2 weeks ago. We're certainly seeing a surge in cases, and the emergence of this Omicron variant has certainly changed the plans than we had expected as we go into this holiday season. And so I do want to acknowledge, how triggering this is for us to be going into and experiencing this fourth wave of COVID-19 with an increase in cases, and certainly a totally new factor that, for some of us, we've always knew that this could be a possibility, that a new variant, more transmissible than the Delta variant, could emerge. But certainly what we have at our disposal is much different than a year ago. And so the first wave and the second wave will be different because we have so much that we know we could be used to fight back on this pandemic. So let me just first start off by saying that what we are seeing in our data, we are seeing an increase in cases. Right now, our daily average, meaning over a 7-day period, how many cases are we averaging? Right now, we're at over 5,000 cases. On a given day, we could see over 65 to 7,000 cases. And that is a lot. That's a lot of people who are testing positive. And we know that there could be more because some people may not be getting tested. And so we also see our test positivity over 7%. And that trend has been increasing. So while the majority of cases in New York City are still Delta, we know that the Omicron variant is here in New York City. And so we have to expect that more people are going to test positive, more people are going to need to isolate and quarantine. And so it's going to be really important that we just do not let our foot off the gas. We need people to take action now. And you've already heard it from the borough president. We got to get the word out. If you haven't received your first dose, we need you to get your first dose. If you're eligible for your booster, and we'll get into those details, we need you to get your vaccine booster. And certainly, we need folks to continue to wear their masks at all times, especially when they're indoors. And everyone should be getting tested as much as possible, especially when you are engaging with individuals who you don't know their vaccination status, being indoors, or you're traveling as well. I've already mentioned the Omicron variant. There's so much that we still do not know at this time. But there are 3 things that we're tracking, and it's really important so that we can provide more guidance. The 3 things are, how easily can this variant spread, right? And that's transmissibility. The second is, how severe are the infections does this variant cause? And then the third is, does this variant escape the protection that we already have? And that could be natural antibodies or vaccine-induced antibodies. So let me just go through each of those one by one. So back to transmissibility. And you've already heard me mention this, because we've always known that another variant could be more transmissible than the Delta variant, and that is the Omicron variant. We already see, based on the number of cases, and certainly the number of individuals who are fully vaccinated and being infected, that this virus can certainly be more easily spread than the Delta variant. So as far as number one, this variant can be more easily spread. So that's certainly concerning. And so it's really important the things that you can do to protect yourself. You can certainly make sure that you're wearing a mask indoors at all times. And you need to figure out and assess your own risk about the level of time that you're going to be gathering with other individuals and the type of settings that you're going to be in. Because what it does is it minimizes the exposure that you have with other people. And certainly for individuals who are over the age of 65, individuals who are may have underlying risk factors, these are certainly questions that you need to ask yourself so that you can make an informed decision about where you go. All right, so second, we talked about, the other factor is the severity of infections. And so right now, some of the preliminary data does show that this virus or variant of the virus causes mild to moderate infections. But here's what you need to be concerned about. Because even though you have individuals who are experiencing mild to moderate infections, what we are seeing is that as we see increasing cases, certainly hospitalizations can follow. And what we need to be worried about is the strain on our healthcare system, overwhelming our hospitals. And that's going to also put a delay on other individuals making sure they get the care that they need. The folks who have delayed, making sure that they got a surgery that they needed, whether it's amputation due to diabetes, type 2 diabetes, or whether they delayed other services because during the pandemic they chose not to. And so folks are coming back to the hospital who may have been sicker than they were before. And so we need to make sure that we're protecting ourselves so that we can keep our hospitals clear and free so that others who need it more have access to those physicians. The third thing I talked about was evasion of our immune protection. And so some individuals have been previously infected, and so they have natural antibodies. And then some individuals have vaccine-induced antibodies. Now, in this city, we know that adults have been doing really well. Over 80% of adults have already been vaccinated. We have over 70% of our adolescents who are fully vaccinated. And we're moving through and getting our younger children vaccinated as well. But that also means that there are a number of people who are unvaccinated. And some of those individuals, even though that they were previously infected, still are at risk, more so than those who are vaccinated, of being reinfected. And the data does show that if you have a previous infection, even if you have natural antibodies, your risk of reinfection is much higher than someone who's fully vaccinated. So that just gives you an understanding that we are dealing with another variant that is going to be concerning and can cause a lot of harm for us. And so we need to do everything that we can to protect ourselves. You may know that my commissioner, Dr. Dept, recently released a new advisory to encourage New Yorkers to help stop the spread of this variant during the holiday season. This is actually a repeat of what we've done last year. December 2020, we issued a Commissioner of Health advisory. And so we wanted to do the same thing to remind New Yorkers that we've been here before. We have all of the tools at our disposal. And just a reminder, here's what you can do. So you can make sure that you're getting vaccinated, getting boosted, wear a mask indoors, especially in public settings, and making sure that you also avoid crowded settings, specifically those who are over the age of 65 and have underlying chronic conditions. Now, testing is also important. And so as I'm sure that there will be questions about, well, there have been long lines. We're working to expand our testing infrastructure in this city. We have one of the most robust testing infrastructure, not only in this country, but compared to other major countries as well. You may have heard last week that the executive director of Test and Trace announced that that Test and Trace, or T2, is expanding their mobile fleet. And in addition, we are activating community-based organizations, over 150, who are going to be distributing 500,000 self-test kits, as well as 1 million high-grade masks to make sure that our communities are safer, specifically those communities that have been hardest hit by the pandemic. We're working with partners who have already been funded by COVID-19 through some of the earlier initiatives that we've done to get masks out, to help people get vaccinated and get tested. And we're going to continue to expand on the CBOs and organizations that we work with. We certainly want to make sure that New Yorkers know where they can go get tested, and certainly where they can get vaccinated as well. And so that just leads me to another point, that we know that vaccines work. All right, the data for the unvaccinated versus vaccinated is striking. And you've already heard where our president mentioned this as well. We see cases We see hospitalizations, their rates are much higher among those who are unvaccinated compared to those who are vaccinated. Just to put a finer point on this, hospitalization rates among unvaccinated New Yorkers, 13 times higher compared to those who are vaccinated. 13 times for hospitalization rates. And cases are 8 times higher among those who are unvaccinated versus those who are already vaccinated. So the message is pretty clear. If you have not heard me say it before, you have not heard our physicians say it before, our healthcare leaders say it before, vaccines work. And so it's really important that we make sure that we help our New Yorkers, our colleagues, our friends, our family members, make sure that they're getting vaccinated. We know that this is the most safest way, certainly the most effective way of preventing someone from getting COVID-19. And certainly, we also know that vaccines are not 100%. So breakthrough cases are possible. And that is why I wanted to make sure that I underscore, emphasize that can happen. And so I didn't say that cases and hospitalizations are zero among those who are unvaccinated. I'm saying that hospitalizations are 8 times higher than those who are vaccinated. Hospitalizations are 13 times higher than those who are vaccinated, and cases are 8 times higher. So we certainly know it can happen, but we know that it happens at far less rate than if you are unvaccinated. And so I want to just underscore the point that we really need people to get vaccinated as well as get boosted. Right now in New York City, we have over 6 million people who are vaccinated. That's 79% of New Yorkers who have already been vaccinated. You've already heard about the great work that Queens is doing. As of today, 85% Queens residents have been vaccinated. So we want to continue to send that message that we have all 3 vaccines that are available. The Pfizer vaccine, which is a 2-dose, as well as the mRNA vaccine, both 2-dose series, but the Pfizer vaccine is available for individuals 5 years and older. So that means that you can take your adolescent, you can take your young child. Someone like me, I'm a father of a 1.5-year-old, she's not eligible. And so it's really important that the people around her, including myself, that we are not only fully vaccinated, that we also have our booster, because it's going to be important that we do everything that we can to protect our little one and all of the little New Yorkers as well. I do get questions about the vaccine mandates. And so quick rundown of what's already in place. We have expanded our key to NYC requirement, meaning that individuals who are 5 years and older need to show at least 1 dose of the vaccine in order to enter into certain establishments, indoor dining, gyms, and other entertainment venues. And these are ways that we are keeping the environment safe for everyone that is in there, in those establishments. In addition, we have vaccine mandates for our city workforce. We certainly have also expanded our vaccine requirement for extracurricular activities, specifically for DOE and charter schools. And now this applies for students in DOE and charter schools who are 5 years and older. We also have a vaccine requirement for our healthcare workers at the state level. And then the governor has also put forward a requirement that says that if establishments have a vaccine requirement or a vaccine passport or a certification process, then you can also you can have a little more lax on your indoor masking. But if you do not have a fully vaccinated requirement for your establishment, then indoor masking is required for those establishments. So that's important because we still want to see that there are additional layers of protection that are implemented as well. Soon to come, we're certainly working to put in a vaccine mandate for our childcare workers. In addition, our non-public schools, specifically staff for non-public schools, we're certainly looking to expand our key to NYC requirement to include 2 doses and not just 1 dose. Remember, I said that key to NYC right now for 5 years and older, but at least for 1 dose. So that actually starts on the 27th. In addition, we're also put forward a vaccine requirement for private sector to mandate their employees. So that's some of the top lines that I wanted to share this evening, and I'm sure that there are questions as well. So I will turn it over back to the VP's team so that we can sort of address some of those questions.
Thank you. And Brent Weisberg is going to go through the Q&A portion. And I want to thank you once again, Dr. Easterling, for your information.
Thank you, Borough President. Thank you, Dr. Easterling, and everyone who's joining us tonight. I hope you could hear me okay. Dr. Easterling, first question in the chat. Testing is available if a person is willing to wait, but 4 days to get results in some cases. By then, is it too late to get the antibody infusion therapy, the monoclonal antibody fusion therapy?
Yeah, it's a really good question. First, let me just, because I hear there are 2 points here. Testing is available, but certainly someone should not be waiting 4 days to get their results. We have been increasing our testing infrastructure so that we can make sure that individuals are getting their results in 12 to 24 hours. And so the wait times for our H&H sites, even for our DOHMH express clinics, we've been making sure that we are returning results within 24 hours. And so I do want to make sure to underscore that folks need to have their results so that they can make better informed decisions. This is also why we are distributing at-home self-test kits so that folks can get their results in a much more expedient way. I'll just make the distinction that the clinics in our brick and mortar sites, they have what is known as the PCR test. That does look at the molecular antigen, which is a little bit different from the rapid antigen test. Essentially, the rapid antigen tests are good and they're sensitive, but they're not as specific. And so if you do get a positive, you certainly want to make sure that you do get a PCR test because sometimes there are false positives. But it's important that if you get or use any test to help make some of those decisions as well. But to the question, yes, we do want to make sure that individuals are getting their test in a clear timeline so that they can make decisions about treatment and therapeutics. Certainly in hospital, any type of therapeutics like monoclonal antibody, healthcare workers are making sure that they have those results so that they're able to respond. Now, antivirals, which we're going to learn more about as the FDA does put down a decision on whether or not the antivirals that can be used over the counter, we're going to certainly also need results quickly so that people can then use the antivirals as well. I mean, but these are all things that we're planning for in our operations. But I just want to underscore that we are making sure that results do return much quicker than 4 days.
Thank you, Dr. Easterling. And as far as being able to get the antibody therapy, are you limited to a certain time frame to get that, or it's really up to the medical provider doing the treatment? How does that work? Because I think that was also part of the question.
Right. Yeah. And so we've been doing a lot of work with our providers. So yes, you do need to engage your medical provider for the therapeutics for treatment to be prescribed monoclonal antibodies. And so it's really important that a person engages their physician. But we've been doing a lot of outreach to really encourage providers in New York City to make sure that they know they have monoclonal antibodies available. And we're still also calling on the federal government to increase our supply. And you may have heard the mayor talk about this today. We want to make sure that we have ample supply of monoclonal antibodies, but we also have access to the oral antiviral, and that will give and expand our ability for individuals who may not need hospitalizations or required to be in a hospital, but they could see their physician and they're able to use an antiviral to treat them for COVID-19 infection.
Thank you so much. Next question. Do people who are fully vaccinated, including 2 shots and a booster of either Moderna or Pfizer, need to get tested as well?
Yeah, so I think this is a really good question. So fully vaccinated is someone who has received 2 doses of either the Moderna or Pfizer or 1 dose of Johnson & Johnson. But as I mentioned, the Commissioner's Advisory certainly is encouraging all New Yorkers to get tested. Certainly if you are in settings where you may have been exposed to someone who is unvaccinated and may also be infected, or if you've done any recent travel or you're returning from travel, even if you're attending a gathering. These are all reasons, good reasons for people to be getting tested, just so that they can make sure that they're keeping themselves safe, and then also anyone in their home who may not be eligible to be vaccinated or could be at higher risk for COVID-19 infection.
Thank you. I'm gonna get the questions as they come in here. So there's a string of questions as far as testing sites in certain particular parts of the borough. And I do want to acknowledge, I believe we have some clergy leaders throughout the borough who are on this call with us tonight. So with that being said, question. We appreciate more recently a presence of COVID-19 mobile units in Southeast Queens. However, the means to communicate their presence needs to be improved. A partnership with clergy of the area being affected reaches the community to promote more manual contact is the term being used here, and contribute to increasing first vaccine dosages. We need to balance location assignments of COVID-19 units. Thank you for your efforts to improve this outreach in Southeast Queens. So if you could just touch upon assignments and partnerships with religious institutions and CBOs and so forth.
Yeah, well, the starting point is we certainly want to do more, and any recommendations that come up in this town hall certainly can be shared with the Borough President's office, and we're happy to work with the Borough President's office to make sure that we follow up. And the fact of the matter is, we know that we need our clergy leaders to make sure that we're messaging factual information and helping individuals to be informed about the decisions they need to make to protect themselves and their loved ones in their community. So I thank you for raising the point. And we are trying to expand not only our mobile testing units, but we also want to make sure that residents know where they can get vaccinated. You know, we're not at 100%. We are at 85% in Queens, but we need to do more, and we can. So we have to get the message out. So I'll just say that, please let us know where we can go, how we can work with you. We've been working with clergy leaders all throughout the pandemic. We've been also finding ways to host vaccine clinics and testing clinics, also making sure that we have boots on the ground, getting messaging out. And so, as you've heard, we've done PSAs, but we know that more needs to be done. And so this is not a pat on the back. This is really a plea for me to just let us know how we can continue to work with you.
Thank you, Dr. Easterling. And just to reiterate, the Borough President's office is consistently taking those inquiries and recommendations as well. And we've had a tremendous partnership with DOHMH as well as Test and Trace and HHC. So thank you for your work. Next question is a three-part question from an individual constituent. Should individual or household members who live in apartment buildings avoid using elevators with other residents? And what distance in feet and for how many minutes does someone have to be exposed to someone who has the Omicron or Delta variant to become infected? And do we need to be concerned about transmission and becoming infected by touching a surface that is contaminated? So this plays to community living, I believe, and shared spaces.
Yeah, no, these are all really important questions. So to the first question, should individuals avoid using elevators? If you can, but I know that everyone can't. And I'm just saying that because oftentimes the elevators are really enclosed spaces, they're tighter spaces. But if there are ways in which you can limit the number of people who are in those elevators, that to ensure that there is some distancing, if that is possible, certainly try to do that. But I know that there have been steps to really ensure that we limit the number of people, reduce density in those elevators. But sometimes that's very challenging. So I would say, if you can take the steps, please do so. If you have to take an elevator, you can take some additional steps to just make sure that you reduce the number of people who are on the elevator at the same time. And so this follows up to the second question about the time. We don't have different information specifically just for Omicron, the Omicron variant. what we know is that your exponentially goes up as far as your risk when you are less than 6 feet within someone who has been exposed for longer than 10 minutes or more. So just as a reminder, so less than 6 feet, which is why we always talk about distancing, 6 feet. But then for that time duration, if you are there for more than 10 minutes, then that increases your exposure to someone who already may be infected. So that I would just say that is still the case as it applies for Omicron. And then to the third question, which I've already forgotten, sorry.
That's okay. So it's, do we need to be concerned about transmission and becoming infected by touching a surface that is contaminated?
Correct,
So
right.
pressing a button to go on an elevator, a handrail, something of that sort.
Yeah, we've learned so much more, certainly about this respiratory virus. And we were certainly worried about contact with surfaces. That has been less of an issue, and more data has been shown that the risk of transmission and exposure just to contaminated surfaces is much lower. Really, it's through respiratory droplets that have been transferred from person to person, and that increases your risk of exposure. So we worry less about contaminated surfaces, but that doesn't mean that it doesn't hurt to disinfect a certain area, certainly in public, washing your hands. All these things are still helpful because it's not just about COVID-19. Remember, we're in flu season. But there are other viruses that are circulating as well. The common cold, which is also most often caused by a coronavirus. So these things are still helpful to make sure that you're disinfecting where you are, washing your hands, and also doing elbow bumps still.
Thank you, Dr. Easterling. Being out in the community and getting an opportunity to go out to local eating establishments, and there are some eating establishments who are not asking for proof of vaccines. Is this a mandate for every eating establishment?
Yeah, so for Key to NYC, we have clear guidance who would fall under the Key to NYC requirement. If there are outdoor sitting areas, certainly that will not fall as much into the Key to NYC as indoor dining, where the mandate and requirement actually applies. But certainly you can follow up with us and we can make sure to engage that establishment just to really make sure that they are following the guidance. We need people to follow the guidance. This is what keeps people safe. This is what prevents further spread of the virus. And so, please let us know. We can follow up.
Thank you. And again, the Borough President's office could be a conduit there as well. General email is info@queensbp.org. Next question. Are people who smoke tobacco products at a greater risk of having complications if they become infected with COVID-19, including the variants?
And so it's not so much just about smoking. It's also about the change in the immune system. Again, higher risk for those who do have underlying chronic conditions. And so oftentimes we know that respiratory diseases do occur, are much higher in those who do smoke. We know about asthma. We know about chronic obstructive pulmonary disease. We know about emphysema. These are all things that are related to our respiratory system. This is a respiratory virus. And certainly because of the respiratory virus and a lower immune system related to your respiratory system, yes, it does pose a higher risk for the COVID-19 virus. So it's important that we continue to do all the things that I talked about earlier, but certainly also we take steps to really help people also not smoke as well. And we're certainly share that information. Our call line, the Nicorette gum, and there are many other things that we do as a public health agency to really help people stop smoking.
Thank you so much. Please clarify DOE mandates regarding vaccinations.
Yeah, no, really, really good question. So the current mandate that we do have in place, we have a mandate for DOE schools that applies to staff, teachers, principals, anyone that's even volunteering in the building is going to come into contact with children. We do have a vaccine mandate for those staff. In addition, there's also a requirement for extracurricular activities that do occur for DOE students, high-risk activities, basketball, football, bowling, certain things that are definitely indoor for children that are 5 years and older as well. And so these are some of the key vaccine mandates that are already in place.
Thank you. Can we have a 24-hour display of the infection rate, vaccination, and hospitalizations of high incidence in zip codes to let everyone in the zip code take action to reduce the numbers and keep the virus away from the zip code?
Yeah, this is a good question about what data do we use and how flexible is our data that can actually give us a better understanding of what's happening. But certainly when we drill down to those zip codes, we know that those numbers are much smaller and we want to protect individuals' identity. And it's really important for us as public health professionals. So oftentimes we aggregate this information. And there's a lot that we can sort of glean when we can aggregate based on an entire neighborhood as opposed to just looking at the zip code. Because as we look at a larger sampling, we're able to really direct our activities and our strategies. And so we use the indicators. We use test positivity. We can even look at it by neighborhood. We look at our transmission levels, and we also look at our hospitalization and death rate as well. And so these are ways in which we can really direct our resources. And certainly, as we collect this information, I know that the mention around 24 hours, but our surveillance system does take time for us to really aggregate and analyze the data. And so that this is also really important so that we can ensure the accuracy about the information that we're putting out as well.
Thank you so much. From a constituent, I need a certified PCR result for my job. Where can I go to get tested? I could not wait on long lines and do not want to pay $75 each week for a test. What can the city do better to help alleviate the lines?
Yeah, that's a good question. I would say, please go onto our website and certainly NewYorkCity.gov/test and trace. You can identify testing locations. And on our website, we do have the wait times for those testing locations. And maybe my colleague, Samantha Lawrence, can drop that link in the chat so that folks will have it and be able to not only direct for themselves, but then also to share with others.
And Dr. Easterling, that's a good segue to this question. How and where can one obtain an in-time list of locations of where the mobile vaccine units and I suppose testing units will be on a given basis? My church is in the vicinity of a local school and no one knows where they'll be, meaning the units. As a faith-based organization, knowing this important information can assist and support our efforts in getting our congregations at those in communities vaccinated at higher levels.
Yeah, and so we put all of this information on the same site, not only our brick and mortar testing location, but also our mobile vans are posted on a weekly basis. So certainly any organization, including our clergy leaders, can look at the website and be able to see where we have our mobile buses for both vaccines and testing.
Great. Here we go. How effective are cloth masks or disposable masks against COVID?
How effective are, sorry, say that again?
Cloth masks versus disposable masks.
Yes.
And then I guess delineate the KN95 as well, if possible.
Yeah, so the KN95s are more high-grade masks, and certainly this is our effort to make sure that we're protecting those who are more at risk, who are more vulnerable. And so, as I mentioned earlier, we're distributing more of the high-grade masks over the next couple of weeks. And so we're going to be working with organizations to get these out, particularly for neighborhoods that have been hardest hit. And so those are the masks that we certainly want people to start wearing right now as we deal with this new emerging variant. The surgical masks are still good, particularly for those who are less vulnerable, may not have any underlying chronic conditions and younger. But certainly the surgical mask and or stepping up to a high-grade mask are adequate. But certainly, I think the cloth mask does provide some protection, but we've seen, because of the seal that we want to apply, making sure you have the wire part over the bridge of your nose that really closes across the nose, and making sure that it's covered below the chin. All of these are steps to make sure that we're getting a good suction across the face to protect you. And it does really increase your protection against any respiratory droplets.
And is there any sort of location list where you could pick up masks or at-home tests, and when are they available and when will they be picked up? And I believe there was some updates to that today.
Yeah, so we're going to be posting this all on our website over the next couple of days, where individuals can get high-grade masks and actually also help their individuals get also be able to pick up any self test kits as well. So we can follow up with this group. Brent, I can share with you sort of the process if anyone is interested, so that we can reach out to them and follow up.
Please do. Yes, thank you. And just as far as testing is concerned, the borough president retweeted on his Twitter today the list of Queens sites that are put out by DOHMH. So that's at Queens BP Richards. So that's QNS BP Richards on our Twitter, and you have all that information there. What is the procedure to follow if someone has detected positive in a COVID test and the person has not been vaccinated? So I guess quarantining and when to seek medical care.
Yeah, and so let me just be clear. So someone has tested positive. Is that right?
Someone tested positive. Well, let's do both. So someone tested positive and they were not vaccinated. And then that person also had exposure to other folks that maybe, let's do have or have not been vaccinated.
Got it. Okay. So if someone has tested positive, they need to consider themselves a case and they need to isolate. And that's important for all of us, even if they're fully vaccinated, because it's likely their exposure could be transferred to someone else, or their infection could be transferred to someone else. So I would make sure that someone who has already tested positive, they need to isolate. And that's regardless of their vaccination status. And certainly right now, it's really important testing positive, because we need to limit the spread of COVID-19. Now, if someone has been, and let me just back up, if you have tested positive and you can call 212 COVID-19, speak with a physician, speak with our contact tracers under Test and Trace, but also, reach out to your own provider as well, so that they're aware that you have tested positive and answered any questions that you may have. So I would say that's really important. Usually once someone is tested, because we do have a good tracker of all the different COVID-19 tests, Pcr tests that are done in the city by all the different labs, our team, our Test and Trace team, will be following up and making sure that this person who has tested positive, that they are situated, that they may not need a hotel room, that they've received a take care package. All these things are really important to make sure that we are supporting individuals as they're going through this, and that's important. Now, on the other hand, if they've been exposed to someone who has tested positive, certainly one, getting tested themselves if they're experiencing any symptoms that over the course they could just quarantine automatically and assume that they're also positive as well, because any sniffles or anything of that nature after being exposed, certainly we want to limit any spread, and that's important as well. Now, if you're fully vaccinated, you can certainly get tested again, 3 to 5 days later, and see if there has been any change in your results. And I think that's really important. We do see breakthrough cases, so we need to assume that even if someone is fully vaccinated, that there is a risk that they can be infected as well. So it's important that even if you're fully vaccinated and been exposed, you should get tested.
And how long should they quarantine for? Let's remind the viewers.
Oh yeah, you should quarantine for at least 10 days.
10 days from exposure or from potential positive result?
No, it's certainly from exposure if you know it, but then if not, then the test results.
Great. Now, Dr. Easterling, all due respect, there are some questions in the chat that, for lack of a better term, go against the grain from some of the other questions that we've had and answers that we've had. And if you're comfortable with them, I'll ask a couple of them.
Sure.
Okay. With pharmaceutical companies not having responsibility, and this is a quote, if anything goes wrong, they have immunity from lawsuits. Will you, I guess the city, guarantee our health?
What I would say here, and I think that this is an important question, because I think what it raises is the concern about vaccines. We have done a number of things to build confidence of how vaccines work. We certainly trust the science. Vaccines work, and we've gone through a number of different times how they work. This is all about making sure that our bodies have the information so that we can mount an antibody response to the virus. The vaccines do not give the virus itself. It does not cause COVID-19 infections. So that's the science, and we trust that it works. The data has also been clear. Millions of people, not just in New York City, millions of people across the world have been vaccinated with these vaccines. And we have not had any serious reported side effect, meaning death. Now, we do see that there are some side effects related to, Johnson & Johnson. You see that there's thrombocytopenia, which is a rare disorder. We also see inflammation around the heart related to Pfizer with younger boys. But these are temporary risks. And certainly the benefit of being vaccinated outweighs any risk that we do see with these vaccines. They happen at a much smaller clip than the things that we're mostly worried about. The things that most commonly occur are the symptoms that we know about: the soreness in the arm where you've been vaccinated, the headaches and the fevers and the chills, but those are temporary, 24 to 72 hours, and they go away. And so this widespread notion that vaccines are harming us certainly just hasn't been shown in our data.
Thank you, Dr. Easterling. And with that, another question came in. How come more people died this year than last year if vaccines and masks work? But you did just allude to that. I don't know if you want to opine on that a bit more, but your discretion.
Well, I'll just say that we've seen death continue over the course of this entire pandemic. And one of the things that we've always been saying is that, vaccines are not 100%, but what we do see is that cases, hospitalizations, and death are currently more at risk for those who are unvaccinated. And so we always knew that unless we can get the messaging and information out there, people are going to be at risk. They weren't going to get vaccinated. And so we are seeing that certainly across in not only our city, we're seeing this across the globe, that we got to make sure that we're getting the word out around how vaccines are safe and effective. But when it comes to cases, when it comes to hospitalizations and deaths, we have certainly seen the highest of those peaks happen during the first wave. And that's what we're trying to avoid right now.
Thank you. Who do we contact if results are not received in 24 to 48 hours? And I'm going to caveat there, and I'm going to say, make sure that that is related to a city-run site, because there is also a number of privately run sites where this information could be different. So with that, Dr. Easterling.
Yeah, that's absolutely right, Brent. When it comes to the city-run site, you can call 212 COVID-19 and they can follow up on your results. You can also make sure that you have the number of the location where you receive your test at. There are a number of privately owned establishments, and those privately owned establishments are responsible for making sure that they get you your results, and you should follow up with them, whether they're an urgent care or whether they're a pharmacy. Those are not city run, but we certainly expect that they should be getting people their results, and it's really important.
Quote, I realize that it's not a New York City DOH/MH call, but with increasing COVID infections daily, how could huge public gatherings, even outdoors, such as New Year's Eve at Times Square and other locations, continue to be scheduled?
I'll just say this, this is much different than we were last year. Yes, we are seeing increases in cases. Certainly, we have more vaccines and more vaccinated people across the city than when we have before. And so there are certain things that are safer. Having an outdoor gathering, a holiday gathering, I think is safe for individuals. We don't want to shut down everything. We're really trying to avoid major lockdowns. And we know how important our schools are, not only for the overall well-being of our child, but social emotional learning as well. And so, we're going to continue to follow the science and the data. And things, as I've said on the outset, things are moving and changing quickly. And as we continue to monitor it, we'll see what decisions are to come. But you can trust that as public health professionals, we'll continue to share this information and making sure that New Yorkers know what to do to protect themselves and their families.
Thank you. Question from the forum. With our subway stations needing to be cleaned regularly, can you catch COVID from being at these stations or on the trains? I believe this says, especially when it's filled with flu, if I'm reading that correctly. So maybe talk about being on trains in close quarters and the heightened sense of flu season, and if you could get the flu vaccine at the same time as your COVID vaccine, so on and so forth.
Yeah, we certainly know that there is risk, which is why we certainly encourage, individuals to wear a mask when they are in high-risk settings. Certainly on public transportation is one of them. And one of the things, the other way that you can protect yourself is getting vaccinated.
I'm sorry, Dr. Effluvia is what was written in the chat.
What's effluvia?
I don't know. I don't know what that's in relation to. It said on the subway related to effluvia.
Got it. Well, I saw COVID, so I wanted to. I'll address the COVID. I'm not sure what effluvia is, but one of the things we've been messaging is wearing a mask indoor, and certainly that decreases risk of transmission, not only for COVID, but also for flu as well. And so that's going to help protect individuals. And then the other thing that will protect individuals is getting vaccinated. You can certainly get vaccinated at the same time for COVID and for influenza. And so these are things that I do want to make sure that individuals know about. Okay. Yeah. So.
Great. What is the timeline when new batches of vaccines are made and administered to the general public, especially boosters? So I guess as new variants come about, are there new vaccines made in relation to the variants?
So we still have the current batch of vaccines that have been made, particularly for COVID-19. The science has been clear as we've been looking at data that the vaccines are effective against the Delta variant, which is the dominant variant in New York City. But then we also see that adding boosters also protect against both the Delta variant and then also the Omicron variant, as we see data from both Pfizer and Johnson and also Moderna. And I think that's going to be really important as we go forward. Now, we do know that the manufacturers are working on additional formulations of the vaccine, particularly focused on the new variant. And we certainly don't expect to see anything for that new formulation until the new year. But the data does show that the current formulation, this is the same formulation that we've been using against the ancestral strain, which is the original SARS-CoV-2, and even against the Delta variant, that it is effective.
Thank you, Dr. Easterling. There is some pushback as far as two answers are concerned in the chat. So from an individual earlier, VAERS is showing death from this vaccine. You said there are no deaths, more injury and death from this vaccine than the last 33 years. And doesn't unvaccinated mean either one jab or you're more than 2 weeks away from the second? Isn't that what's considered unvaccinated in a hospital? So it's the same line of questioning from this constituent. So if you want to touch on that.
Yeah, so unvaccinated, it does mean that a person is not fully vaccinated. That is absolutely right. And so fully vaccinated, again, would be two doses from an mRNA vaccine, Pfizer or Moderna. And then you also have one dose from Johnson & Johnson. And it will be 2 weeks after the final dose. So 2 weeks after that second dose for the mRNA, and then also 2 weeks after the Johnson & Johnson. So that's how we would consider a fully vaccinated person. But we do look at, when we're comparing unvaccinated versus fully vaccinated, you're talking about someone who meets the definition of fully vaccinated, because the data has been clear about the effectiveness of those vaccines based on those 2 doses in an mRNA vaccine or 1 dose in a Johnson & Johnson. So that's why we're looking at those definitions very distinctly. And then when talking about the vaccine adverse event reporting system, which is supported by both CDC and also supported by the FDA. So you can have individuals who have died, but it is not confirmed. What is not done is that investigation of what is the cause of that death. But what we continue to look at is not just the VAERS reporting system. We also look at scientific data to see if there's been any retrospective data that shows that there is a direct connection to individuals who have died as a result of taking the vaccine.
Thank you, Dr. Easterling. Going back to the subway, sadly, and this is a continuation, sadly, unhoused people are relieving themselves at subway stations. Can you catch COVID from being around it or waiting from chains? So from urination or defecation, can you catch COVID from being in the vicinity of that?
Yeah, I would just remind that the COVID-19 is a respiratory virus, and so coughing, ingesting, singing, those are the ways in which you are transmitting or spreading a respiratory virus, and which is why it's really important that we do encourage individuals to wear their masks in public transportation, public settings, indoor settings, because you are limiting the possibility of being able to spread respiratory droplets and vice versa, being exposed to it. So those are really important. But I know that there's been a lot of work by our colleagues at MTA to make sure that there's distributing masks, making sure that people are safe on the trains and the subways.
Thank you. And I have the last 3 questions here on the chat because we are coming down to time. I believe you've touched on most of them already, but just to recap. So can New York City COVID website show more recent data? So individual states it was 15 days behind this morning.
Yeah, so there, a lot of the data is updated. Some of the graphs are a little bit different than others, but we certainly try to update it within the 7-day time span.
And is there any list of places where masks or at-home tests can be picked up in the borough or even outside of Queens? I will say Borough Hall has contributed over something like over 100,000 masks throughout the community we've distributed. We are running low, but hope to restock very shortly with our partners in government and private colleagues. So when Borough Hall restocks, we will definitely get that out into the community. But I don't know if the city has a more formal plan that you'd like to touch upon.
Yeah, I think what we'll do is work with you, Brent, to get more information out about where we're distributing our high-grade masks and at-home test kits. Yeah, this is certainly important as we continue to go into the holiday season to make sure that folks are protecting themselves.
Fantastic, thank you. And last question for the evening: how could a faith-based organization get the opportunity to have a mobile vaccine unit at their establishment? Which you did touch upon. If you want to just do final thoughts.
I will just say, and just to wrap up, it's just thank you for all the work that you all do as leadership in your own communities, in your own houses of worship. Please continue to raise your thoughts and ideas of how we can get the message out. Please continue to raise your suggestions about where we can direct more of our resources, even where we can set up mobile vaccine clinics, testing sites as well. And just want to go back to my earlier points. We are certainly in a changing environment, and we have to do everything that we cannot take our foot off the gas. We have to use all of our tools, and that's vaccines, testing, and masking. And so we continue to look forward to working with you, partnering with you, and protecting our communities. We're going to get through this. Thank you.
Thank you so much, Dr. Easterling. And we put Borough Hall's contact in the chat, info@queensbp.org, or our landline 718-286-3000. And now I'll give it to our Borough President, Donovan Richards, if he'd like to add any final thoughts.
Let me thank you once again, Brent and Dr. Easterling, for hosting this tonight. And you got a lot of good information. I want to thank you, Dr. Easterling, for putting out some great information tonight. I'll continue to stress to residents: get vaccinated, 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 wear your mask. I don't know how many more times we can say or allude to the same things that we're talking about tonight. But I hope that the information you received tonight is beneficial and ensuring that you're more armed with accurate information so that we can make it out of this next wave. And we know coming out of the holiday season, once again, we're going to start to see those numbers continue to go up and then, God willing, plateau. But the war has to be won now. And that takes all of us being a part of the solution. So I want to thank you once again, Dr. Easterling, and thank all of those who participated. Even if you had opposing views, it's important that, we're able to answer those questions in a factual way to make sure you're armed with the correct information. And once again, this is not by any means, because you're vaccinated, mean that we won't see breakthrough cases. But once again, this is about preserving life and saving life. And we're going to be working very closely with many of our hospitals, because we don't want to get to the place we were sometime last year where hospitals were out of beds, and so we're trying to avoid that. But the only way to avoid that is for us all to be in this together. So thank you all for attending tonight.